Well, November is Lung Cancer Awareness Month. The disease is the leading cause of cancer deaths worldwide. Nearly 250,000 Americans will be told this year that they have lung cancer. Routine screenings are limited to a certain risk, but senior health correspondent Monica Robbins reports on research on a blood test that may make finding it happen much sooner.
It's no secret cigarette smoking is the main risk factor for lung cancer. It's linked to nearly 90% of cases, but it's not the only cause.
Family history, parents, brothers, and sisters had lung cancer, your risk is a little bit higher. Other exposures, if you handled and worked with asbestos as part of your career, if you're exposed to radon gases in your home.
Currently, low-dose radiation CT scans are used to find lung cancer, but only for those aged 50 to 80 with a 20-year pack-a-day smoking history who still smoke or quit within 15 years.
This has been standard of care for a well-defined high-risk group for the last 8 years or so. I wish more people who were eligible were coming to get those screening scans done, because we'd be able to save a lot more lives.
Because only 10% of those eligible are getting screened. That's why Dr. Mazzone is researching a test that could detect lung cancer DNA in the blood.
Tests that can identify those really low levels of DNA in the blood may be able to tell us that somebody has an early stage lung cancer, prompting them to go get a CAT scan of their chest and find that cancer before they get sick with it.
The blood test was able to detect early-stage lung cancer in 92% of cases. Dr. Mazzone doesn't think we'll have to wait too long to see it become available.
I wouldn't be surprised if a lung cancer screening blood test was available within the next year or two, and more to come with even more and more accurate tests available over the next 5 years plus.
Now, currently, the blood test is still in research and only being used on those who fit that high-risk criteria. But Dr. Mazzone hopes to see it expand to anyone who may be at risk. And meanwhile, researchers identified one specific inherited genetic mutation that can lead to an increased risk of lung cancer in families. This may help develop even more improved prevention, screening, and treatment for lung cancer. And part of this research was done at Ohio State University Medical Center, Jay.
Yeah, that certainly is the hope, Mon. We know that Ohio just passed Issue 2 earlier this week. That, of course, means that people can now smoke marijuana legally and recreationally. Does that increase their risk for lung cancer?
You know, there's likely concern for any substance we breathe into our lungs, but Dr. Mazzone told me that to date there isn't strong evidence that marijuana smoke or even vaping causes lung cancer. But keep in mind, it took decades before it was linked to cigarettes as well.
Yeah, that's a very good point. Monica Robbins, live from the newsroom. Mon, thanks.